Chain of infection. The chain of infection refers to the steps by which an infectious disease is transmitted from one host to another. It provides a systematic framework for understanding how infections spread and how they can be prevented. Let's start the step with the infectious agents. They can be any microorganisms which cause infections, such as bacteria, virus, fungus, and protozoa. The place where the infectious agent lives, grows, and multiplies is called a reservoir. This could be in a human, animals, or the environment, like soil or water. In healthcare setting, the patients, healthcare professional, and the hospital beds and the devices can also act as the reservoirs for harmful microorganisms known as the pathogens. The route through which a microorganism leaves the reservoir and spread is called the portal of exit. It includes breaking in the skin and body fluid release when a person coughs, sneezes, vomits, urinates, and bleeds. A mode of transmission is the method by which microorganisms spread from a portal of exit to a portal of entry. Transmission can occur through direct or indirect methods. The direct transmission, involves direct contact with microorganisms or droplet spread. On the other hand, indirect transmission involves the spread via contaminated devices, equipment, or airborne particles. The route through which the infectious agent enters the new host is called portal of entry. Common portals of entry include the respiratory tract, gastrointestinal tract, skin, mucous membranes, and bloodstream. Susceptible hosts are people who are more likely to suffer from an infection. Susceptibility depends on the various factors, including the immune systems, age, underlying medical conditions, patients using certain medical devices or undergoing certain medical procedures, and genetic factors. For example, neonates are vulnerable to the infections due to their immunity. And also, it is hard to diagnose and progress very rapidly. Therefore, it is essential to break those links in this chain to prevent the spread of infectious diseases. Let's look at each step again how to prevent. To prevent the infectious agents from living growing, reservoir must be controlled with appropriate measures. In healthcare facilities, frequent touch objects and surfaces such as desks should be cleaned with water and soap. However, cleaning alone cannot kill many pathogens, especially on medical devices such as thermometers, stethoscopes. For those type of equipment, the disinfection after cleaning must be performed. Since disinfection cannot eliminate spore-forming bacteria, it is important to sterilize semi-critical and critical reusable medical devices such as the surgical instruments. The effective pest control measures are also essential to reduce the risk of transmission of the diseases from animal reservoirs. Example, using the mouse traps or applying the pesticides to control the rats and prevent diseases like plague and leptospirosis. The infection prevention policy must be in place because they provide structure and systematic approaches to minimize the spread of infectious agents. To prevent pathogen from existing the reservoir, the portal of exit must be controlled. For example, patients, caregivers, and healthcare professionals who can act as human reservoir, we must adhere to hand hygiene practices by either regular hand washing with soap and water or applying with alcohol-based hand sanitizer. Wearing the mask, gloves, gowns, and face shields as appropriate, especially in healthcare setting, it's also important to prevent the spread of infections. Not only wearing, but also proper donning and doffing technique It's also important to avoid the self contamination. In addition to these measures, adequate ventilation systems should be established to control aerosol and splatter. The respiratory etiquette involves covering the mouth and nose with the tissue or the elbow when coughing, sneezing, and then disposing of the tissues properly. It's also important. Don't forget performing the hand hygiene immediately afterward. It's also very important. Proper waste disposal prevents the accumulation of infectious materials and reduces the risk of exposure to pathogens. Example, sharp objects like needle must be discarded into a sharp box. As a next step, to prevent the transmission, in addition to hand hygiene practices and the proper use of PPE, cleaning and disinfection of the objects, food safety is also one of the preventive measures for food and waterborne disease. This includes ensuring proper handling, cooking, and storage of food to minimize the contamination risk. Regular hand washing and surface cleaning while preparing food are essential practices. On top of that, it is crucial to prevent cross contamination by using the separate cutting boards for raw meat and other food items. Another method is called isolation, which separates individuals who are infected or are suspected of being infected from those who are healthy. We have applied this method a lot during COVID-19 pandemic. To prevent the infectious agent from entering the host through any possible portal of entry, in addition to hand hygiene and PPE that we apply for other steps, seeking proper first aid can prevent the infectious agent from entering the host through the wound. And personal hygiene also plays a key role in preventing infectious agents from entering the host by reducing the likelihood of exposure to pathogens. Keeping medical equipment, such as the catheter or the tubes, in place for an extended period allows the bacteria enough time to colonize and cause the device associated infections. Therefore, these devices should be removed when they are no longer necessary or replaced with a new one if they still need to be used. Certain hosts are more susceptible to infectious agents and should be protected through the specific measures. It involves the immunization. As an example, the measles vaccination given for under 5 children to prevent contracting the measles. Underlying health conditions can also weaken the body's immune system and it makes individuals more susceptible to the infections. For example, the HIV patients are immunocompromised patients. They need antiretroviral therapy to improve their immune system. Without antiretroviral therapy, their immune system remains weakened and making them more susceptible to the opportunistic infections. Lastly, if the susceptible host becomes infected, how can we prevent the further spread of the infectious agents? The susceptible host should receive an accurate diagnosis to ensure the appropriate choice of antimicrobials. Secondly, the antimicrobial stewardship program should be implemented to prevent the spread of the infections and the development of the antimicrobial resistance in those infectious agents. In conclusion, understanding the chain of infection allows us to identify how we can interrupt it at each step. As you can see, the infection prevention and control plays a key role in breaking the chain. Additionally, one measure alone may not be sufficient to prevent the infection. We should implement as many preventive measures as possible to effectively control and prevent the infections.